Reach out with us. Make your impact where it matters most. Go light the world. Community Solar Foundation, a non-government organization of Papua New Guinea, formed by Papua New Guineans, managed by Papua New Guineans, for the benefit of Papua New Guineans. Papua New Guinea is an independent island nation located directly above Australia. Community Solar is dedicated to finding solar solutions for the electricity needs of Papua New Guinea. At this time, the focus is on community health centers. The first step is to provide the staff at the community health centers with solar lanterns. The solar lanterns also include a USB charger. Thus, the lantern can be used to charge cell phones, laptop computers, and other devices. During the visit, the Solar Community's representative will assess the health center to see what other forms of solar power are appropriate for that location. Please travel with us as we assess 2 rural health centers and provide solar lanterns. Most people in Papua New Guinea live in rural villages and have no access to electricity. Welcome to the first health clinic that we will visit today. Health clinics are strategically located to provide health care to the people who live in the rural villages. It is their only source of health care. Providing solar lanterns to the staff of rural health centers is one way that we can immediately help them with their need for reliable lighting. The health centers do their best to meet the needs of their community. Without reliable electricity, it is difficult for them to run the equipment that they do have. Many rural health centers do have generators. However, the cost of fuel is very expensive. Thus, the generator cannot be run at all times. Rural health centers also have housing for their staff. However, the houses often don't have electricity. Thus, providing solar lanterns helps the staff in their own homes, as well as be able to provide services after dark to their community. Travel with us to another health center. It is not always easy to get to the remote health centers. Often a 4-wheel drive vehicle is required. This health center does have a limited solar system set up to provide refrigeration for vaccines. There is a great deal of potential to add additional solar panels to provide lighting and other services. As we saw with the first health center that we visited, this health center also has a generator. However, fuel is limited and it must be used sparingly. This health center does have a water tower to provide running water. However, the pump to fill the water tower is broken. This is an area where solar would really benefit. A solar water pump would help draw the water from the holding tank up to the tower to provide running water to the patients and staff. In Papua New Guinea, when a patient needs to stay overnight at the health center, a friend or relative will stay with them. A kitchen area is provided where the friend or relative can prepare meals for the patient. However, there is no lighting because there's a lack of electricity. Thus, having a portable solar lantern is something that can be shared with patients and their caretakers to provide light during the dark night. This is the area where patients can wash themselves. Providing a reliable source of water is very important. A solar water pump would help accomplish this. As funds become available, Community Solar will return and install the pump. The solar lantern with USB charger is lightweight and compact. It's very well made and perfectly suited to use in places where electricity is limited or not available. The ability of Community Solar to distribute solar lanterns to the health centers is completely dependent on fundraising. As funds are raised, solar lanterns are purchased and distributed free of charge to the community health centers. Here we see a medical professional providing care to a patient. It's daytime, so there's plenty of light. Imagine, though, if it's dark. Without electricity, how would that medical professional provide the best care possible? Having a solar lantern makes a world of difference. Without it, medical professionals have to rely on flashlights, kerosene lanterns, or, if fuel is available, the generator. We also see a picture of the pharmacy. You can see because it's daylight, but think about when it's dark. A medical professional needs to have good light so they can provide the best care possible to their patients. Solar power is the natural solution. Another example of how windows provide natural light for treating patients during the daytime. However, think about what happens when there's emergency after dark. Having a reliable source of light is very important. These are photos of the staff housing. Solar lighting is definitely needed.
Okay, we come from Community Solar Foundation to provide sustainable power, especially in the rural health centers, to assist in making sure that service delivery regarding the health issues must be addressed in a manner that can sustain the lives of the rural people in PNG. And this is Borogaina Health Center. Borogaina Health Center. It's powered by standby diesel genset. But apart from that, they don't have any source of power. They only use solar panels for refrigerator, powering the refrigerator to store vaccines and all this. But the rest of the building is in darkness with staff housing. So what do you think will how will the lantern that we provide to you will impact your service delivery to the local?
All right, thank you. First of all, I want to say thank you to you all. My name is Benson Yaking. I'm from Morobe. I've been working here for almost 4 months now. I've been coming since December. When I was here, like carrying out my work, there is so many life difficulties that we are facing in these health centers, and one of them is a source of power, light. Like in the night, when we working in the night, we used to have torchlight. We have a standby generator, but the problem is we do not have fuel enough to power the building, since if emergency came in. So I think the solar light or lantern will help us much, because during the time of emergency we need light to work. Like deliveries, doing suturing at night, especially emergencies. When we attempt to emergencies at night, we need light. So just because we have problem with fuels, we used to put on the generator for at least 1 hour or 2 hours, and then we put it off again after completing procedures or something. But like doing admission and doing all reports, we have to use our own light to do all this. Just to do procedures, we use generator, and after completing any procedures, we put it off, and then we use our own torch headlight to do reporting.
Sometimes mobile lights.
Yes, we use mobile lights
and torch and all this.
Yeah, but as like now you come and you told us to provide us solar, I am very happy, and I think it will help us so much.
That's correct. That is the area where our government is neglecting these remote people. They are only concentrating on the cities and towns and all this. And the unfortunate people in the village are being forgotten, and the situation for the health services is like this now at the moment. So I think we are providing the best service to the people.
Thank you. I think I have nothing to say, but I want to say the big thank you to you because this is one of a very big problem in this health center. So like when you come inside, you solve this problem. So I think in the night we can use solar light to do any procedures or anything that happen in the night.
Thank you.
Thank you.
The people living in the rural areas of Papua New Guinea face many challenges. They need your help. Please consider getting involved today. Donations can be made through GoFundMe. Use the keywords solar power for health centers and aid posts in PNG. Your help is needed. Your help is appreciated. Please consider getting involved today. Your help will make a difference.